I'm Dr. Billy Cook with Karen Dixon and our office manager. We're discussing the challenges of excellent customer service in our optometric office with our team members. We talk about customer service a lot, but until we discovered how to illustrate the series in a PowerPoint slides, we never made a good connection to our team members' way of thinking. Most of these situations illustrated came from actual incidents happening in our office, Vision Health Specialties in Midland, Texas.
We're going to begin with how a patient will enter the office. So the patient walks into the office. We consider it to be bad if the receptionist's head is down, looking anywhere but at the patient. If they're looking at their computer screen, talking on the phone, interacting with other employees, this is not the behavior we're looking for. We consider it to be good if we at least say welcome and please sign in and show them the sign-in sheet. What we would consider to be great customer service is if they actually greet the patient. Good morning, Mrs. Jones. We've been expecting you. This would be for an established patient. Or, welcome to our office, Mr. Garcia. Thank you for coming in today. That would be appropriate for a new patient.
Okay, sometimes our front desk is busy and we have our techs ready to take patients back for pre-testing. We would consider bad if they're just standing around talking to themselves and not looking at the front area of entrance and ignoring the patient. They could at least go in and say, good, please sign in if the front desk is busy. Great would be welcome, sign in please and I'll get you checked in. And they can help with the welcome back form or the welcome to our office form.
Another note would be on the insurance. If the patient comes in and there's no notes regarding benefits, in other words, we have not looked at their insurance prior to their visit and there's no VSP authorization pulled. Good would be is that if we at least have the insurance notes updated and put in the correct box and a VSP authorization pulled into the system. What we would be aiming for would be great, that the insurance notes are updated, a VSP authorization is pulled into the system, and there are notes on the guest sheet and the patient is notified of the benefits so they're not in the dark as to what they would be expected to pay this day.
Our next thing would be about patient costs. Bad service would be the patient was not informed that payment was expected at time of service. Good would be letting the patient know that payments are expected at time of service. But great service is informing the patient about their copay or if private pay and explaining that there may be additional fees depending on what else the doctor may perform or order that day.
If someone is walking in and just needing information regarding a past visit on their insurance or billing question, bad would be, well, the insurance department is down the hall to the right, just basically sending them blindly down the hallway. Good would be at least calling the insurance department and informing them that a patient needs help. Of course, great would be, may I ask your name? Okay, Mr. Smith, I have your information in front of me. How may I help you? Instead of making them wait for yet another employee to answer their question.
The next thing we have issues with is patients coming in for either the contact department or the eyewear gallery. Bad is just pointing and going, say, go through the arch to the contact lens desk. It's right over there. Good would be to step over to our eyewear boutique, our contact lens department, and someone will be right with you. Great would be let me show you. We walk the patient to the area, ask their name, and introduce him to the employee who would be assisting them. Great service is what you see at a Ritz-Carlton hotel. If you ask a question of someone there, they will always escort you to the right area. We would like to achieve this in our office.
When a new patient comes in, we would always like to acknowledge that they are new and we would welcome them to our practice. So a bad example would be not acknowledging that they are a new patient. Good would at least be asking if we've seen them before and then acknowledging them. But great would be, are you new to our practice? Well, thank you for calling us today, or thank you for coming in.
Established patients, bad a service is not acknowledging that they are established. In our database, we have when people have been first in our office, and we have patients going back over 25 years. So sometimes they're surprised that we have information that long. Good service would be to say, looks like your last exam was July 14th in 2016. Great service would be if it shows you've been seeing Dr. Cook for many years, and thank you for your confidence in our office.